Hello guys, welcome all of you to today's Pharmcast. I'm Dr. Ranjan, your pharmacology faculty at Marrow. And guys, today's is the last Pharmcast where we'll cover the remaining topics of Autacoides, respiratory system and kidney, right? So we'll wrap up with entire pharmacology in today's Pharmcast. So this would be the 10th Pharmcast and I had been posting the schedule, and if you had been following the schedule, you would have realized by now how much it is helpful. Specifically using the method of read, revise and re-revise, right? So let's begin with today's topic, Autacoides, guys, antihistaminic drugs which are H1 blockers. There are two generations of H1 blockers, first and second generation. Now these first generation drugs, they are sedating, and that is the reason why they are contraindicated in children, elderly or workers like drivers and pilots where they can be detrimental. So this brings us to an MCQ which they ask about second generation. So they ask you, for example, a driver is having rhinorrhea and truck driver is having rhinorrhea, and you are supposed to prescribe an antihistaminic. Which one you should prefer? And your answer is a second generation. So you'll have three first generation, one second generation, like cetirizine or loratadine. That is what you need to go for an answer. Apart from that, second generation, they don't ask that commonly. In first generation, remember they have anti-muscarinic effect as well, right? So three drugs, promethazine, diphenhydramine, dimenhydrinate. These three have maximum anti-muscarinic effect, and that is why their uses are not antihistaminic, rather they are anti-muscarinic. The most recent one being asked, they had asked you, which of the following antihistaminic is used in motion sickness? And your answer was promethazine. Right, so we know that for motion sickness, the drug of choice is scopolamine, which is also an anti-muscarinic. But I can also use antihistaminic like promethazine, which is much cheaper. Now the MCQ which they ask you is about, because promethazine, diphenhydramine, dimenhydrinate, they have anti-muscarinic effect. We can also use them in extrapyramidal side effect, to be precise, acute dystonia and Parkinsonism. Right, so this MCQ has been asked a lot of times, and mostly it is about acute dystonia. So they'll ask you, a patient was prescribed an antiemetic like metoclopramide or an antipsychotic, and the patient develops abnormal posturing. What should I use for treatment? Now usually my drug of choice is benzhexol or trihexyphenidyl, which is anti-muscarinic drug, but half of the times they won't give you these in option. They would rather give an antihistaminic, and always it is promethazine. Right, so there are two MCQ points about promethazine, motion sickness and acute dystonia. Doxylamine, it is another first generation drug which is drug of choice in morning sickness. Chlorpheniramine, it is least sedating drug in first generation and prefer for daytime use. Right, that's all they ask in first generation. In second generation, in the last 10 years, MCQs have not been asked really, but sometimes they ask about which antihistaminics are topical only, and these are second generation topical only, like olopatadine, azelastine, alcaftadine, epinastine, ketotifen, levocarbastine. So you just have to go through these ones. Now coming to serotonin and related drugs, the 5-HT1 agonists, they are used as anxiolytics, and this MCQ has been asked a couple of times. One MCQ is direct, which is a 5-HT1 agonist, and an answer is buspirone, ipsapirone, gepirone, right? Second type of MCQs they had asked you is, which of the following is a non-benzodiazepine anxiolytic? But because benzodiazepines are also used as anxiolytic, and your answer was buspirone. Then we have 5-HT1B1D agonist. See, 5-HT1B1D agonist, these are drug of choice for acute attack of migraine, but remember the MCQ point here, they are not used for prophylaxis. So they had asked an MCQ, which of the following drug is not used for prophylaxis of migraine? Your answer was sumatriptan. So I cannot use it for prophylaxis, I use it for treatment, right? What else they can ask you is about the oral drugs which can be, slow acting and fast acting. Mostly here the MCQ points would be fast acting, like rizatriptan, which is fastest acting. Sumatriptan is also fast acting, and so zolmitriptan, elatriptan. So these are faster acting ones. So they can ask you which is fastest acting triptan. Now why they would ask about fastest acting triptan? Because see, how fast a triptan would be effective, it would depend upon how fast it is absorbed. So in other words, the pharmacodynamics of a triptan, it depends upon the pharmacokinetics. So the faster it is absorbed, the more is the efficacy in an acute attack. Right? So there is this reason they can ask. But remember, overall, if they ask which is the fastest, and route is not mentioned, then your answer would be subcutaneous sumatriptan. It is overall fastest acting. The last MCQ point with respect to these triptans is about contraindication of triptans like sumatriptan, and always your answer is angina. Now in angina, triptans can be detrimental because triptans are vasoconstrictor, guys, and they can precipitate an acute attack of angina or even cause worse, myocardial infarction. So angina is your answer, right? Now there are some other drugs used in migraine like ergotamine, and ergotamine, the only MCQ they ask you is about, the MCQ goes like this: a female was given a drug for acute attack of migraine, and after that she developed blue discoloration of her feet. Which drug she was started upon? Your answer is ergotamine, because ergotamine is a very, very, very powerful vasoconstrictor. So it can cause gangrene of organs with end arteries like your fingers and toes. So it is mostly about the toes or the feet where they ask. And second MCQ which is recently asked, they had given you an angiogram of the lower limb, and they asked you which drug could have caused this, and there was vasoconstriction of the lower limb arteries. And again, your answer was ergotamine, and this phenomenon is called as ergotism. Drug of choice for prophylaxis of migraine, it is propranolol. That's one thing they ask. Second, they can ask you prophylaxis, which is the anti-epileptic of choice nowadays. It is topiramate. Now, drugs acting upon 5-HT2, right? So these are rarely asked. Just remember one point, which is the drug of choice for serotonin syndrome. Your answer would be cyproheptadine. Now moving on to page number 60 in One Touch Pharmacology book, because this is a pharmcast or podcast based upon One Touch Pharmacology book. So many of you ask me, right, where the book is available. So in YouTube, in the description, I've given the link on Amazon, right? Now coming to page number 60, NSAIDs, which are cyclooxygenase blocker, non-selective and selective. Selective COX-2 blocker, these are coxib, celecoxib, etoricoxib, parecoxib. These are rarely asked, guys. So you can just forget about this. Non-selective, they are more commonly asked for a simple reason, they are more commonly used. And the non-selective ones, the most commonly asked, 90% of MCQs, right, in Autacoides is on paracetamol. And why paracetamol? Because paracetamol is like God. It is omnipresent, it is present everywhere, right? So, what they ask you about paracetamol, mostly you need to remember is, number one, it is the most common cause of drug poisoning for a simple reason, available everywhere. What happens? Hepatotoxicity, an MCQ point. What increases the risk of hepatotoxicity? Chronic alcoholics and fasting. What causes hepatotoxicity? A metabolite called as NAPQI that depletes glutathione, which is a free radical scavenger. And this is the MCQ precisely asked in your last NEET PG. NAPQI causing hepatotoxicity, which drug is implicated? Paracetamol, guys, right? Histopathological examination in the liver, you'll find centrilobular necrosis with periportal sparing. Dose causing hepatotoxicity, in milligrams per kilograms, it is more than 150 to 250, or cumulative dosing more than 10 grams, right? Treatment, this is frequently asked MCQ, guys. Drug of choice is N-acetylcysteine. And if there is no response, the patient will go into liver failure, and the only thing that I can do is liver transplantation. The second drug, aspirin. Now remember, the MCQs are not that commonly asked on aspirin. Dosing is asked. What is the anti-inflammatory dose? And remember, high dose, 3 to 4 grams per day in divided doses, is anti-inflammatory. Ray's syndrome is sometimes asked. So the contraindication, which NSAID should not be used in viral fever in children? Aspirin. Second important MCQ point is, which NSAID should not be used in gout? Aspirin, as it increases uric acid, right? Indomethacin is commonly asked, 2 MCQ points. Acute gout, what is the drug of choice? Indomethacin. Which NSAID is used in closure of PDA closure? Indomethacin. But the drug of choice for PDA closure in India is ibuprofen, right? Diclofenac, it is well concentrated in the joints. That is what is good in arthritis. It's an important MCQ point. Other than that, NSAIDs are not that commonly asked. Moving on to the last part, inflammatory disorders, gout and rheumatoid arthritis. Acute gout, drug of choice is indomethacin, as we have discussed. Colchicine can be used, but it is not that commonly used. So MCQs are only based upon mechanism, like what is the mechanism of action of colchicine in gout? Your answer is either it blocks microtubules or blocks chemotaxis or leukocyte migration. Same thing. Whereas in chronic gout, the first class of drug, these are xanthine oxidase inhibitor. Allopurinol is the drug of choice for chronic gout. Is the most frequently asked MCQ on gout, right? The most recent MCQ being in the last fmge exam that asked you a patient having symptoms of gout, and they had asked you a drug which mechanism of action would be able to prevent this disorder, and prevention is long-term management. Your answer was xanthine oxidase inhibition. Side effect, it causes hypersensitivity. And remember, if there is allopurinol hypersensitivity, I use oxypurinol. If allopurinol is not effective alone, I stop allopurinol and I can use febuxostat. Febuxostat is more effective. Uricosuric agents, they're not that commonly asked, so you can skip it in the revision, no big deal. Uricase analogs, pegloticase, is used in resistant chronic gout. And the MCQ that I can recall, they had asked you once is, which of the following is an enzyme used in gout? Enzyme. So even if you don't know anything, you can go for the answer, go for the kill. The reason being ASE. Any drug that ends with ASE is an enzyme, right? So now moving on to rheumatoid arthritis, the drug of choice is methotrexate. That's one MCQ. Second, which is an anchor drug in rheumatoid arthritis? Again, your answer is methotrexate. Third MCQ, how does it act? Mechanism of action. Remember, it is not inhibition of DHFR. In rheumatoid arthritis, the mechanism of action is rather an increase in adenosine, right? If the patient does not respond, then I can go for the second line drugs. So you can read the second line drugs, whichever they are. Hydroxychloroquine plus sulfasalazine or leflunomide or biologicals. Remember, biologicals, the most frequently asked MCQ is on the name of the drugs. For example, which of the following is a TNF alpha inhibitor? Infliximab, adalimumab, golimumab, etanercept, right? Which is interleukin 6 blocker has been asked a lot of times, tocilizumab. Interleukin 1 blocker, anakinra. CD20 blocker, rituximab. CD80, 86 blocker, abatacept. Names are important, guys, remember. And note, if the patient does not respond to biological, I can use another biological, or I can use a JAK inhibitor like tofacitinib, baricitinib, upadacitinib. JAK inhibitors are also important. They will be asked in your exam. Now moving on to second topic for today, respiratory system. There are only few MCQs which I'll highlight here. See, bronchodilators in bronchial asthma. So we're already on page number 63 in One Touch Pharmacology book. And see, beta-2 agonist and anticholinergics we have discussed in autonomic nervous system. So we kind of skip it here. Methyl xanthines. Say methyl xanthines, first of all, your MCQ is on the mechanism of action. How does it act? So remember, it blocks phosphodiesterase 3 and 4. That is what produces bronchodilation. So sometimes they ask you, second MCQ, mechanism is, it also blocks adenosine receptor. So there are two mechanisms of, bronchodilation present with methyl xanthines. Anti-inflammatory effects are because of phosphodiesterase 4 block, apoptosis of neutrophils, histone deacetylase stimulation, and an increased interleukin 10. Now, majority of the MCQs which are asked upon theophylline is based upon side effects, and the MCQ they have asked you is diuresis is because of block of which receptor, and an answer is adenosine receptor block, A1 adenosine receptor block. So remember, adenosine receptor block causes arrhythmia, seizure, and diuresis, the severe one, right? Whereas phosphodiesterase 4 block causes headache, nausea, and vomiting, right? Steroids. See, inhalational corticosteroids like fluticasone, mometasone, budesonide, cyclosonide, beclomethasone, these are used. Cyclosonide and beclomethasone are called as soft steroids because these are prodrugs activated by esterase in lungs and they have lesser side effects. So this is an MCQ point which are called as soft steroids. Steroids are the drug of choice in persistent asthma. Plus, nowadays, the treatment of choice for the reliever in intermittent asthma is ICS plus formoterol. Other than that, steroids are not that commonly asked. One MCQ that asked you is, what is the mechanism of action of steroids in acute attack of asthma or exacerbation of asthma? See, there are multiple mechanisms. Steroids decrease mucus secretion, they decrease inflammatory mediators, but they also increase the effect of beta-2 agonist. This is the answer, by increasing the density of beta-2 receptors. Apart from that, all other drugs in asthma, like mast cell stabilizer, they ask the name of the drugs. Which is a mast cell stabilizer? Your answer is either cromolyn sodium or nitochromyl. They ask you which is a leukotriene blocker. Your answer is montelukast or zafirlukast. They ask you which is a lipo-oxygenase blocker. Your answer is xylutone. They ask you which is an anti-IgE mAb. Your answer is omalizumab. That's all. I'm done with bronchial asthma, right? Now, antitussive. See, if you look at antitussive, the centrally acting is important, and there are two classes, opioids and non-opioids. Opioids are codeine, folcodeine, ethyl morphine, morphine, methadone, right? Non-opioids are drugs like dextromethorphan, levopropoxyphene, noscapine. So the MCQ they ask you is which of the following is an opioid or non-opioid antitussive. So they will jumble up these options, you have to answer, right? Now coming to the peripherally acting antitussives, they are rarely asked, they're never asked actually. Expectorant, the only drug that is an expectorant is guaifenesin. Only MCQ, which of the following is an expectorant? Guaifenesin. Mucolytics, here they do ask you which is a mucolytic. Your answer is usually N-acetylcysteine, Ambrexol or Bromaxin. Second MCQ here, they ask upon the mechanism. N-acetylcysteine, it breaks disulfide bond in mucus. Ambrexol and Bromaxin, they depolymerize the mucopolysaccharides, right? So guys, that's all you need to know in the topic of respiratory system. Now we will come down to our last topic for today's Pharmcast, and that happens to be kidney and diuretics. So majority of the MCQs are asked from the topic of diuretics, and if you look at this, I have covered the entire topic of kidney in one page. And see, the 5 classes of diuretics: carbonic anhydrase inhibitors, loop diuretics, thiazides, potassium sparing diuretics, mannitol. The first set of MCQs is the site of action. So, I've arranged them based upon site. Like carbonic anhydrase inhibitors, first comes first PCT, loop diuretics, thick ascending limb, thiazides, DCT, potassium sparing diuretics on collecting duct, and mannitol mostly on PCT and loop, they act, right? And these are osmotic agents. Second set of MCQs is based upon mechanism, like which drug blocks carbonic anhydrase, acetazolamide, which drug blocks or how furosemide or loop diuretics act, they block sodium potassium 2 chloride channels. How thiazides act, they block sodium chloride channels, co-transport, right? How does spironolactone act? It blocks mineralocorticoid receptors. Or how does amyloride act? It blocks epithelial sodium channels, right? That's all with the mechanism. Now coming to uses, the MCQs I have covered all in red color. Acetazolamide, they ask you what is the drug of choice for what is the drug of choice for mountain sickness? And your answer is acetazolamide. That is what is most commonly asked. Drug of choice for mountain sickness, acetazolamide. Loop diuretics, the frequently asked MCQ, what is the drug of choice for pulmonary edema? Drug of choice for pulmonary edema, your answer is furosemide most of the times. Now, remember, the diuretics which are effective if GFR is less than 40. GFR is less than 40, that is renal insufficiency. The best diuretics are loop diuretics, right? Apart from loop, the only other class of diuretics which are effective with GFR less than 40, this is only one thiazide, that is metolazone. So this is an MCQ guess. Only thiazide effective with GFR less than 40 is metolazone. So these are two important MCQs, remember. Best diuretic, GFR less than 40, loop diuretics. Only thiazide effective, GFR less than 40, metolazone. So in fact, they had asked an MCQ, there is a patient of hypertension with renal insufficiency, which of the following drug would be used? Your answer was metolazone, right? Thiazides, the drug of choice for hypertension with edema or osteoporosis. So see, usually if they ask you, they'll give a patient of chronic kidney disease with edema and hypertension, and they'll ask you which of the following drugs should be used. Your answer would be a thiazide. And they're also drug of choice for nephrogenic diabetes insipidus, right? Whereas potassium sparing diuretics, spironolactone, it is a drug of choice for cirrhotic edema and resistant hypertension. Cirrhotic edema has been asked recently, and it has been asked many times. Whereas amyloride, it is a drug of choice for lithium-induced diabetes insipidus. Mannitol, it is a drug of choice for cerebral edema and drug of choice for acute congestive glaucoma. Both have been asked multiple times in the last 10 years. Right, now coming down to side effects. Now side effects is hell of a task. If you look at the side effect, I've given you, parallel to each other, all the side effects, but looking at the side effects, you'll have, vertigo because there is hyper everywhere, and by the time you end reading the side effects, you get hyper. So I'll try to summarize these side effects by giving you just a simple story, right? So be with me, just look at the book. Look at the book and let us make a story around this classification. Let us say loop diuretics and thiazides. This is the house. So my house is loop diuretics and thiazides. So I'm talking about the hypokalemia. So you can make a house around the side effects of loop diuretics and thiazides. And suppose carbonic anhydrous, it is the front of the house. This is the road. And potassium sparing diuretics, it is the back side of the house, and this is my backyard of the house. Now let us see how can I remember the side effects. So I'll just ask you questions, right? Let's talk about acid. Now acid, acid is dangerous. So where would you keep acid? Inside the house or outside the house? Obviously outside. So outside house means carbonic anhydrous inhibitor and potassium sparing diuretics. So metabolic acidosis is caused by carbonic anhydrous inhibitors and potassium sparing diuretics, whereas alkalosis is caused by loop and thiazides. First thing, right, from this story you can learn. Second, if I ask you where would you find stones? On the road or inside the house? On the roads, obviously. That means renal stones is caused by which class of drug? Carbonic anhydrous inhibitors. Second, you know that cow dung has ammonia, right? And where would you find cow dung? Inside the house or outside the house? Inside the house or outside the house? Obviously outside, on the road, right? So cow dung on the road, ammonia on the road. Which drug will cause hyperammonemia? Obviously, answer is what? Carbonic anhydrous inhibitors. Suppose there is a piece of bone. So you eat some chicken or mutton, and the piece of bone, where will you find stray pieces of bone? Inside the house or outside the house? Obviously outside the house. So bone lying on the road, so means bone marrow suppression. So caused by carbonic anhydrous inhibitors. So which means what? What do I learn? Renal stones, hyperammonemia, bone marrow suppression, it is caused by carbonic anhydrous inhibitors. Now look at another side effect. If a person develops gynecomastia, will he go outside in the on the road and show it to everybody, or will he hide on the backyard? Obviously, he will hide on the backyard. So gynecomastia, it is caused by spironolactone, right? Now, coming to the most important part here. See, guys, sugar, uric acid, calcium, these are our wealth, isn't it? These are our wealth and these are precious things for our body. So where do you store precious things, right? Inside the house or outside the house? Pretty obvious, I'll store them inside the house, right? So any change in glucose, uric acid, magnesium or calcium is bound to happen where? Is bound to happen inside the house. So look at the book. Hyperglycemia, hyperuricemia, hypomagnesemia, these are all seen with only loops and thiazides. Calcium is different. Loops cause hypocalcemia, thiazides cause hypercalcemia. How do we remember this? Loops lose calcium. Loops lose calcium. That is the reason why they cause hypocalcemia. Loops lose calcium, right? So, in this story, the last part is, see, only class is called as potassium sparing diuretics, which spares potassium, means it does not cause hypokalemia, it causes hyperkalemia. Other than that, all the drugs, carbonic anhydrous, loops, thiazides would cause hypokalemia. Now we'll come to the neighbor. See, mannitol is the neighbor house. And this neighbor house, he's sitting and looking at your house, which is having all hyper, and mannitol goes crazy. He sees what is happening in this house. It's hyper everywhere. So mannitol cannot decide what it needs to do in his house, so he does everything hypo and hyper. Hyperkalemia, hypernatremia, metabolic alkalosis, acidosis. So it cannot take control of its house, and because of it, it dies because of pulmonary edema. So it's an important MCQ I marked in red. Pulmonary edema is a side effect of mannitol, but the drug of choice for pulmonary edema is loop diuretics. So guys, I hope after listening to this story, you would be able to easily understand and remember about the diuretics. Now coming to vasopressin, see analogs. Vasopressin analogs, desmopressin is drug of choice in central diabetes insipidus, nocturnal enuresis, hemophilia A, and von Willebrand's disease. So these are MCQ points. Terlipressin is drug of choice for acute varicose bleed. That's all you need to know in vasopressin analogs. Antagonist, they ask you which of the following is used in SIADH. I use a Vaptan. So remember, conivaptan, tolvaptan, mosavaptan, that's all they ask. So Vaptan, so vasopressin antagonist is called as Vaptan, right? So with that, guys, we're done with your topic of kidney, and hurrah, we are done with the entire pharmacology with this Pharmcast. And you see, my aim of releasing the book One Touch Pharmcast was to make your life easier with revisions so that you can quickly, the book has only 42 pages, which you can easily revise in one day, right? So in the last leg of revision, it will become important. The aim of doing this Pharmcast is so that while passively when you are running or you are driving to your job or you are doing anything, right, or taking a stroll in the evening, you can just plug in your headphones and passively learn something. Or you can, along with this book, you'll just feel that I am with you. Whenever you are reading this book, you'll not feel that you are alone. I am there with you, right, metaphorically and in reality as well. My good wishes, my blessings are always with all of you, right? Now, we have come to the last part of the Pharmcast, and today is the last Pharmcast, and I feel sad about it that I will not have to record any Pharmcast. So I should feel happy, isn't it? What do you think? Right? So, but I'm not happy. I'm sad because this is the last Pharmcast, and until the next time, right, I'll not be recording anything now. But anyways, I do cover any one of your doubts, as all of you guys know, right? And one student had asked me, sir, there is a news going on about postponement of the exam. And I don't know, my heart says that let the exam get postponed so that I'll have more time for revision and I can perform better, right? And that is why I want the exam to get postponed. That's one side. On the other hand, my heart has already, taken a decision that the exam is going to get postponed. I'm quite confident about it. And that has somehow relaxed my subconscious mind. And I'm not able to put in that many number of hours. I'm not able to put in that much of intensity to my prep. So what should I do? Now guys, I don't know if the exam will get delayed or not, because I don't have that kind of contacts. I'm a very, simple person. And whatever information you have, I also have the same information. But looking at the things which are going on around us, I don't feel the exam will get postponed. I might be wrong. I'm not saying I know it 100%, but I'm saying my personal feeling. I feel it will not get postponed. And anyways, if at all the exam gets postponed, then also see what happens is you might get some more time to prepare. But remember, other students will also get more time to prepare. So which essentially will not change anything, right? It's not going to change your rank much. The only problem is those students who are going to run after rumor and lay down their guards, they'll be the loser, right? Because if the exam happens on the same date or does not happen on the same date, there are students who are giving in equal number of hours and intensity even in this period. So what you need to do is calm yourself and keep preparing, keeping 5th March as the date of exam, right? So don't try to loosen at this period of time, because loosening up your guard at this time would be foolish. And you have spent so many years, right, waiting up to this moment so that you can give this exam, and probably it would be the last exam in your life if you're not going for the NEET SS exam, of course, right? And you'll move on with your life. So guys, don't loosen your guard. Keep 5th of March as your date and keep preparing ahead. Now, so I guess that's all with the Pharmcast. And if you guys have any more doubts, you know where to contact me. I'm readily available on Instagram. The one medium where I answer all the doubts is Instagram. My, my handle, it is Doc Pharmaniac, or you can search my name, Ranjan Kumar Patel. You'll find my handle on Instagram. And you can message me anytime about any kind of doubts, no matter how foolish the doubt might sound. You can message me. and I answer all the doubts. I have an impeccable record of answering 100% students. 100%, yes. It might be, impossible to believe, but I do answer to each and every one of you. I answer to everyone. I might miss someone by mistake, but I don't do it like I don't answer knowingly, right? I answer. I try to answer each and every doubt you have, because in my life I don't believe in doing a lot of things. I believe in doing one thing and doing that thing properly. So the only thing I do is, I teach you guys, right, in online platform, offline platform, and I do this podcasts, etc., etc. So my motto is, to do one job and to be good at it, and this is the only one job that I have. And what makes it worthwhile is you guys, right? You guys, the smile on your faces and your happiness when you share with me that when you have got whatever you decide. That is what makes my life worthwhile. And I love all of you unconditionally, irrespective of how you perform in the exam. And I wish all of you all the best, guys. Take care. Love you. Bye-bye.